Good evening, ladies and gentlemen. Welcome back to another weekly edition of the Americans for Prosperity Tennessee Weekly Legislative Update. We're jumping all over topics today, as we did last week, and I hope that's what you come to expect from a program like this. We will be discussing anything and everything at the state level, anything and everything at the federal level, and giving all of you a deep dive into what is moving in the states and what is moving in your state in particular. If you are brand new to this program or brand new to what we're trying to do here each week, let me give you a quick breakdown as to what this is. It's more than just what I described. It's more than just going over bills. It's more than just what's happening at the Tennessee legislature. It's more than just ways to take action, although that is a big part of it. I think a lot of people follow several other channels on YouTube or watch, say, some news channels at night, and there's nothing to do afterwards. What do you do after? What do you do with all this knowledge? We can provide ways to take action like I personally believe no other grassroots organization can. But this program is more than just information and ways to take action. I would really like it to become a commentary-driven program from the members of Americans for Prosperity Tennessee, but especially from y'all watching. If you're watching on YouTube or Twitch or Facebook or wherever you may be watching this, if you're watching now or even later on, put those comments in the comment section. That really drives the content development of this program. Message us later on afterwards. Let us know what you're thinking, what you'd like to hear more of, what you'd like to hear us discuss and cover. With that being said, my name is Grant Henry. I'm the Grassroots Engagement Director here in Middle Tennessee. And we have, three other individuals on with us. We'll kick it to James first. James Amundsen, buddy, how you doing? Introduce yourself. Tell them how your week's been. How's the kid, by the way, the new baby boy? How you doing, man?
Hey, Grant, I'm doing pretty well. Of course, I'm James Amundsen. I'm the Deputy State Director for our Tennessee chapter of Americans for Prosperity. One thing I failed to do last week on my first appearance with our weekly updates is just kind of remind folks, my background and how I ended up with AFP. I did start off as an activist and a volunteer. Andy Ogles recruited me in 2016. He had asked me to join sooner, but it just wasn't the right decision at the time. But in 2016, I made that leap of faith. And so here I am today. But you asked me, how's my week going? The week went pretty well. There's a lot of things that we were able to get on notice and get it started in the process. So hopefully we'll see a few more bills be making their way through both chambers, especially some healthcare reforms. I know we're going to talk about a number of different issue areas today. So I won't delay us. I'll let us finish introducing the rest of the team.
That's what I'm talking about, James. Let's go to whoever's going to flip their camera on first. By the way, when y'all see me look over here, it's a second monitor. Mickey got it. You won, buddy. We'll kick it to Mickey next. Mickey Shelton out in Tri-Cities area. Introduce yourself. Tell us how you're doing.
Mixie, I like that name. That's a good name, Mixie. But, my name is Mickey Shelton. I'm out of the Tri-Cities area. We had a great training this weekend, by the way, just giving a little plug in on that. We certified 36 activists ready to be plugged into their community. So if that's something that you would like to do for your group or your organization, we would love to certify you in that. Everything from A to Z, grassroots operations, from holding your elected officials accountable, learning how to be influential with them, you name it, we can do it. If you want a speaker, email me at mshelton@afphq.org, and we'd love to get you set up.
And by the way, if you appreciate all the graphics that you're seeing here and down here and the little Americans for Prosperity logo and the cool transitions into and out of things and the sharing of the screens and all that, one man is responsible. His name is David Thompson. He's out in the Knoxville area, and you may just be able to hear audio from this guy because he's behind the scenes. He's like Wizard of Oz back there. There he is. Hey. How you doing, buddy? What's up? Let's start the program here by diving into the very first story, and I'm going to share this so we can all read this along together. This is coming from Politico, as you see there at the top of your screen. Zoom in one more time so everybody can read together. Democrats treading lightly on Biden's next big health care promise. After making good on the promise to expand Obamacare, Democrats are weighing a divisive fight over the public option. Now, fresh off securing the first big upgrade to Obamacare since its 2010 passage, Democrats are eyeing a much heavier and politically riskier lift, creating a government-run public health insurance option. Now, President Joe Biden campaigned on the idea, touting it as an achievable reform that would bring costs down without upending private health insurance. I'm going to read that one more time because I believe that sentence is vitally important. Touting it as an achievable reform that would bring costs down without upending private health insurance. I might have a different opinion. I'll tell you why in a little bit. He goes on to say he consistently polls well, apparently, across political spectrums. Now, Democrat lawmakers and allies favoring a public option to compete with private insurers want the party to seize on its narrow congressional majorities to muscle through an idea that has long been popular with their base. They're betting that after years of rising health costs and the GOP's failed attempts to throw out Obamacare, voters in the tightly contested 2022 midterms would reward Democrats for tackling healthcare costs. Here's the most important paragraph of the entire political story so far. This is coming from Senator Chris Murphy, Democrat, and well, you see it right there. We've been toying at the... Say it again, James.
Pretty sure it says Connecticut.
Yeah, that's right. James is correct. We've been toying at the margins of the healthcare system for the last 10 years, and I don't think it's convinced anybody that we're making a big enough difference. Who plans to reintroduce his public option with Senator Jeff Merkley, if I mispronounced that, in the coming weeks. It's time to go big or go home. It's time to go big or go home. Let me kick to James just real quick here as I'm queuing up the next video for what I think Americans for Prosperity reaction is going to be. James, what's your response on that? It's time to go big or go home to a public healthcare option.
Well, I think with a statement like that, there's only one way they can go, and it's not just providing an option. When they say go big or go home, I think it's going to be a complete takeover of all healthcare. So that's the only big go big option that they really have. So that's a frightening idea. I don't know what anybody else's experience has been with socialized medicine or basically government-run healthcare system. I've not personally had that experience, but I've certainly heard many stories from my family members who are still back over in Europe. For many of you who don't know, I was not born in the United States. I was born in Germany. The majority of my family is from former Yugoslavia, Bosnia in particular. But just to kind of put things in perspective, they've been living under a socialized healthcare system pretty much their entire lives. And I've not heard anything spectacular about the access that they have to care or the quality of that care. And I could give you all sorts of examples and anecdotal stories, but I'll spare you guys right at the moment.
Now, you heard me say a second ago about Americans for Prosperity's response to the public option that the political story just discussed a second ago. Actually, instead of me describing it to you, let's just kick this right over to Emily Seidel herself. She will describe what a personal option looks like. I personally believe this is going to be the best of any opportunity we could have to right do wrongs, fix the systemic problems in our healthcare system. Listen to Emily right now.
There's something seriously wrong with the healthcare system in America. We have some of the best doctors, the best hospitals, the best technology in the world. Yet 70% of Americans think that our healthcare system is not working and needs to change. Why is that? It's the system that's broken, completely obstructed by red tape and instability and hidden prices that make it far too expensive with too few options. So the real question is, how do we fix it? When you go out to dinner, you pick the restaurant you want and then you get a menu. You know what your options are, you know how much they cost, and you know how much money you're willing to spend. Why shouldn't you have that same control and choice when it comes to your health care? It's supposed to be about your health and caring for you. And that means giving you the choice and control you want, access to the medical professionals you trust, at a price you can afford. Well, some believe the only way to get affordable care is for the government to provide it, or what some people call a public option. But the truth is that approach wouldn't work. During the pandemic, we saw with our own eyes the massive government failures that made it harder to get folks the help they needed. Things like providing testing kits that didn't work, huge mask and ventilator shortages for our frontline workers, rigid state laws that limited hospitals on how many people they could see, and prevented doctors and nurses from going to locations that needed their help. Why would we ever double down and ask the government to do more in healthcare when it failed us so badly during the pandemic? We have to take a new approach. Healthcare is incredibly personal, and it's time we created a system that was just that, personal, with a personal option, a set of smart, sensible reforms that lower costs and increase access while keeping you at the center. First, let's expand health savings accounts, which can help make healthcare more affordable by saving you anywhere from 10 to 40% off every expense. Second, you should know exactly what your care is going to cost before you get it. So we need price transparency. And finally, we've got to give you more choices by removing the rigid and senseless barriers that stop people from accessing the doctors and the nurses and the facilities that they need. The personal option is the control you deserve, the access you want, and the affordability you need. To learn more, visit apersonaloption.com.
Now, if you want to find what you just heard at personaloption.com, this is going to look a little bit strange on y'all's screen here in just a second, but let me just show you the best way to either take action on what's about to come up or to have your voice heard immediately right now. Now, what you're looking at here is, again, it's going to be weird. It's a Facebook screen. Inside of a Facebook screen, it's going to get a little bit strange and wonky, but follow along with me for a second. Is you see my mouse hovering right up here in the description of this video. Same thing in YouTube or Twitch if you're watching over there. Just expand this little description section. You can click on this Evernote link. And this Evernote link is literally a compilation of the entirety of the notes that our team puts together to run this program you're watching. And it's a lot. Right, if you scroll down here, you can see all the stories that we just went through. You can see some more information. There's the link to the YouTube video. There's a bunch of stuff in here, chock full of great information if you want to take a deep, deep dive, even down into the state issues. Here's all the bills that we're going through here at the state issue in just a second. But the very first thing you'll see up here in this Evernote link is this right here, AFP Healthcare, the personal option. Now, if you click on that, it delivers you to an incredible toolkit of just chock full of ways for you to take action. It explains what the vision is. It puts together, obviously, what the beliefs are, says you can sign the petition in ways you can help. It gives you other talking points, greater access. It lets you look at video testimonials. I mean, there's a number of different ways that you can take action. And it's not just that, as you just saw on your screen a second ago, for a lot of the issues we'll be talking about tonight, whether it's the PRO Act, whether it's state-specific bills, if you, in the midst of watching this program, want to do something about it, click on that link, sign something right there. But James, let me kick this to you here in just a second. It seems like, obviously, Americans for Prosperity's vision, as opposed to a public option, is one that's rooted in a personal nature. And it answers a few questions here, saying, what do Americans want when it comes to healthcare? They want to see doctors of our choice, conveniently and affordably. They want to access the most appropriate treatments. They want access to good insurance that meets our needs at an affordable rate. They want to know how much it will cost up front before we pay for it. And they want safety nets to protect the vulnerable. That very last thing I said a second ago, that they want to know up front the cost before we pay for it. I know we're dealing with a bill here next week. I believe it's House Bill 2 in the state of Tennessee that hopes to address something like that, the surprise medical billing issue. Can you give us a little bit of background on that real quick before we move into some other stuff here?
So I think we touched on this a little bit last week when we were trying to introduce the idea of surprise medical billing. I don't think many people are strangers to this particular situation. Oftentimes it occurs under an emergency situation. You might have a car accident, or maybe a child gets injured an athletic game, that type of situation, and they have to be transported to the hospital by ambulance, and that's not typically something that you have much choice in. And unfortunately, what ends up happening is people get hit with this rather large bill that's unexpected, and it may not be something that's covered under their insurance. And whenever they do get to the emergency room, they may be visited by a specialist that is not someone that is part of their insurance network if they happen to have insurance. So what often happens is the patients will eventually receive a bill from those various providers. which will be in excess of what their insurance will pay. And they will establish a process called balance billing to basically get the difference in the cost paid back to that provider. Most Americans are not prepared for those kinds of unexpected bills, and oftentimes struggle to get those paid off if they ever get them paid at all. Now, at the end of last year, during the coronavirus relief package, that omnibus bill did include a provision called no surprise billing that would actually allow for an appeals process or an arbitration to occur, which would be led basically by the insurance company, and they would negotiate something between that provider and the patient to make sure that there is a means by which for that provider to recoup some of those costs. But there's also a bill that the state is putting forward, which is Senate Bill 1, House Bill 2, and it would address it a little bit more in detail rather than have a arbiter that is provided by the insurance company. It would provide for an independent party, because just imagine you've got all the interested parties involved, and the insurance company, who's the one that would end up paying a good portion of that cost. You're going to let them be the ones who make that decision. And you would hope that they would do what is in the best interest of both the patient and that provider. But they obviously have an interest in that outcome. The state law would provide for some additional resources to be given to those folks to come to some kind of agreement.
And look, just to be fair to both sides here, everyone, let me address the issue for a little bit as to why Americans for Prosperity believes that socialized medicine just doesn't work. If you have just joined us, by the way, that's the topic at hand, okay? A public option as opposed to a personal option when it comes to healthcare. And some people argue for a very different approach than what Americans for Prosperity argues for. They want a government takeover of healthcare. This simple solution, as I'm sure you've all heard. It goes by various names as single payer, national health insurance, socialized medicine, Medicaid, Medicare for all, or public option. The public option, as we're hearing now. And it might sound appealing, but it cannot guarantee the basic protections that people need. People in countries with government-run healthcare typically endure bureaucratic rationing, and long wait lines due to unavoidable shortages of personnel, equipment, and therapies. And in some sense, I think we need to understand that healthcare, like any other commodity or service, is scarce. We only have a certain number of doctors. We only have a certain number of nurses that can provide these services for us. And if it's run by government, it's going to run into the same bureaucratic problems of rationing and waiting lines and everything else that other government-run programs do. And tragically, the burden of such rationing falls heaviest on the most vulnerable of us, the sick, the elderly, the people with chronic medical conditions. Access to a waiting list is not access to care. Take Canada, for instance. I'm sure everybody's heard instances for there, but take Canada, where private health insurance is effectively outlawed. Healthcare is free, yet patients pay for it in other tragic ways. Canadians receive fewer cancer screenings than Americans do and have higher mortality rates for certain cancers. While Americans enjoy access to 89% of new drugs, Canadians only have access to about half because their government deems most new drugs too expensive. The median wait time for Canada for an MRI scan is more than 2 months. To be treated by a specialist, more than 5 months. Canadians end up paying for their free care by being forced to endure needless suffering for lost income and preventable death. So what I'm saying is, even this moderate approach that we're hearing now, this term keeps changing, whether it's socialized medicine, Medicare for all, Obamacare, that the term keeps changing. And this approach we hear now of public option is false hope. There is nothing moderate about it. In this approach, the government, instead of immediately abolishing private insurance companies, hear me here, instead of immediately abolishing private insurance companies, they compete with these private insurance companies while also taxing and regulating them. I'm not sure what other industry or what other you could get away with taxing and regulating your competitor, but that's what's happening here. You can guess what will happen inevitably. It ends in a government monopoly and thus in widespread distribution, cost hikes, and reduced access to care. And again, alternatively, let me kick over here just to show one last time what I hope is understandable for everyone right now, the approach that AFP is trying to take on this. The AFP plans, as you're seeing on your screen right now, highlights are good insurance at an affordable price, access to the latest life-saving drugs at a reasonable price. See that this is coming from National Review. See the doctor of your choice conveniently and affordably, to know how much your care will cost up front before you pay it. Expanding health savings accounts, strengthen health reimbursement accounts, promote telehealth, repeal certificate of need laws. Let me take one of these randomly, at least what might look like randomly on the other side of your screen. Let me take one of these randomly and expound upon that for you, just to show that it's not merely ideas. It's not just fancy talk. It's not just fun conversation. There is real meat attached to these bones. Expand health savings account, for example. You're going to see my face here again. Now, when we're talking about expanding health savings account, a health savings account is a unique and powerful savings tool that helps families pay out of pocket, medical expenses tax-free. HSA owners enjoy the equivalent of a 15 to 40% discount each time they purchase a healthcare item or service, depending on your tax bracket, that is. Now, HSAs give patients greater control of their medical decisions, and studies show that they help reduce healthcare costs. Now, unfortunately, today, only about 10% of Americans are able to even have an HSA because account owners must buy a narrowly defined form of a high deductible health plan. By removing this needless restriction, sounds simple, but by removing that needless restriction, we can allow all Americans to have an HSA. We should also increase HSA contribution limits and allow HSA funds to be used for more kinds of care and coverage. And again, this is not just fancy talk. Americans for Prosperity usually points to the gold standard, what was then called the Health Savings Account for All. At one time, this was brought by Senator Rand Paul, and it's considered the gold standard. They also support something called the Pandemic Eradication and Enhanced Preparedness through Savings Act. This was bought by Representative Ken Buck. I mean, there's a multitude of bills that I'm looking at right now at the federal level. You all can follow along with me. Click the Evernote link, follow in the show notes. When we're talking about promoting telehealth, something that Tennessee did a fantastic job of here in the state, these laws, obviously telehealth, if you're not sure, these laws require local government approval before private entities can invest in, They show that the removal of delivery of medical care services using digital telecommunication tools, if you remove those, it reduces infection and hospital rates and saves money. Wider use of telehealth could unleash a digital health revolution and save lives. But alas, many insurers and health plans impose restrictions. For example, Medicare limits telehealth to certain narrowly defined rural areas and does not allow patients to use it in the comfort of their own home. Congress, we say, should lift these and similar restrictions. And again, here's something for you all to look at. EFP supports legislation to expand Medicare telehealth access, including, here it is, the Telehealth Innovation and Improvement Act. This was brought by Senator Cory Gardner back in the day, and obviously by Representative John Curtis. And there's a multitude of options to reduce costs, to expand access, repeal certificate of need laws, let nurses deliver the care that they're trained for, reduce prescription drug prices. I mean, we could probably go on for the next hour here. But I hope I've delivered the point home, James, that it's not just us talking. There has been a massive amount of research. There are people actively trying to do this. And more than anything, everyone watching, beware, okay? Democrats are signaling quite clearly that the next step, if it wasn't H.R. 1, if it wasn't the PRO Act, next is going to be this public option. And it will be coming on very soon. James, before we switch topics here, man, let me kick it to you for any final closing words, anything else you want to say about healthcare in general, anything to watch out for, anything like that.
Well, certainly we've got a number of healthcare innovations working in our own state. So hopefully that will offset some of the bad legislation that's coming down from the federal government. Here in the state, we are working on reforming certificate of need laws. Those are basically the government permission slips that providers have to get before they can even open up a healthcare facility or provide specific kinds of health services. We would certainly like to eliminate a lot of that unnecessary, burdensome regulation, streamline that process, and hopefully eliminate certificates of need completely. But we'll take incremental steps in the meantime. In terms of reducing costs, probably something that we've already discussed, but probably something that would benefit consumers the most is having a database of all of those costs, and knowing what each hospital and in what in each area what it costs to provide or deliver certain kinds of health services. And there is another bill that's hopefully going to be moving soon, which would create what is described as an all payers claims database. And with that information over time, we'd be able to get a clear sense of what those costs are, and potentially provide that information to consumers so that, again, they can know what it's going to cost them before they ever have a medical procedure performed. I think we've discussed a couple of other things. Kind of ranting a little bit here, just trying to think of what else we've got going through the legislature right now.
Yeah, let's move into some state topics then in sort of the latter half of this program. But before we hit that, if you want to take action at all, again, that Evernote link at the top of the description, whether it's on YouTube, Facebook, Twitch, wherever you're so happen to be watching this, click that Evernote link, scroll through. The very first thing you'll come to is a link for the personal option, a link to make your voice heard on the PRO Act, and a couple other links to sign petitions that go directly to state legislators, making your voice heard on some of these things we're about to talk about. Bills moving at the state level. James, let's start with House Bill 409, Senate Bill 452. Now, it's just a quick update as to what this bill is or was contemplating to do. Look at James' reaction. Is whatever it's supposed to do, right? This is a civil asset forfeiture transparency bill, right? I think Representative Parkinson said that best during subcommittee this week. It's a transparency bill. It will require reporting on how many civil asset forfeitures actually end in criminal conviction. If you don't know what civil forfeiture is, it's where the state or law enforcement can seize and forfeit your property over to the government without actually convicting you of a crime. It's a very weird thing. We don't have time to get into the history of it. But this bill in particular, House Bill 49, not only would it have shown us how often somebody's property is being seized and forfeited without convicting them of a crime, it will also show us the amounts that are being seized, demographic information of the individual that it was seized from, and importantly, the amount of time it takes for someone to go through one of these administrative proceedings. We're hearing that it was only supposed to take anywhere from about 3 to 4 months from the time that your property was taken away till you actually get your property back. It was supposed to be only 3 or 4 months. However, during summer study in 2019, several attorneys came in and said that that's more like 9 months. But we don't know. There's no data reported on it. That's what this bill was supposed to do. Now, you keep hearing me with this sort of dejected, defeated tone, James, and everyone else watching, because that bill ended up not pushing through subcommittee. Now, it was extremely close. I'm talking razor thin. It was 3-3, 4-3. They didn't actually take it to a vote. Chairman Lafferty ended up taking it off notice because Department of Safety came in and argued that they simply cannot practically provide this information. I'm getting, I don't want to speak disparagingly here, James, but I'm getting the sense that that's a response that is heard from that department fairly often, and probably for legitimate reasons. But they came in and Department of Safety essentially said, like, we just don't have the infrastructure built out. There's no system by which I can report this data to you. We unfortunately in Tennessee do not have a unified court system. So how am I supposed to get this information to you? Now, oddly enough, I think Fiscal Review disagreed with Department of Safety on this. The fiscal note attached to this bill was $33,000. So if you're reading through some of these bills, yeah, right, it's low. And the argument that Department of Safety had was, well, that has to be too low because we, Department of Safety, would definitely need a brand new software program or something substantial to get you all this information. And the response they got back was, I don't think you do. I think $33,000 will cut it. So there's a bit of misunderstanding there between what the Revenue Department was giving as a fiscal note of what was required to get the information to you all, the citizens, and what Department of Safety was saying that they just don't have an ability to do it. So nevertheless, I think probably rightfully so, Chairman Lafferty ended up removing it from notice to take a little bit of time, reconsider what was happening here. Now, I just want to speak my 2 cents on this because this was a little bit of my baby bill, House Bill 409, right? I personally thought it was going to do quite a bit to create and construct a narrative by which you could tell the story of what's really happening with civil asset forfeiture in this state. It could create and tell the story of how we are or are not protecting due process rights, property rights, how much we do or do not protect the Constitution. I mean, it was going to give us great data, right? Importantly, in 2019 legislative summer study on a previous version of this same bill, it was determined that almost all of the new information that was requested in this bill is already being collected. It's just not being reported publicly. And last year, this same bill made it through the entire House Judiciary Full Committee and Finance and Ways and Means. It was stopped due to COVID. So a lot of people found it somewhat odd, I shall say, James, that Department of Safety came back again this year with a problem that was not presented last year. You all can sort of fill in the blanks as to why. But look, I'll say it this way, okay? Here's a quick list of states that already give this data to their citizens. And I'm pretty sure if these states can do it, then I think Tennessee can figure it out. Arizona, New Jersey, Kansas, Vermont, Virginia, Michigan, North Dakota, Idaho, Utah, Pennsylvania, West Virginia, Maryland, Missouri, and California. I saved the best to last. Man, if California can figure it out, I think Tennessee can figure it out. Chairman Lafferty has amended the bill, will amend the bill. He plans to bring it back again this week, basically taking out that component of saying, okay, fine, if you can't give me the information on how often it ends in a criminal conviction, then we'll move forward with just the other pieces there. Before I move on to a different bill, though, James, anything you want to say about that? Anything about the committee process itself that stood out to you in that?
I think the one thing that always stands out when it comes to civil asset forfeiture reforms is the fact that it is overwhelmingly popular in both parties. So this isn't as if we're fighting one side or the other to try to get these reforms passed. No, it's quite the opposite. We certainly have bipartisan support on a lot of the ideas that we've been trying to push through the state legislature. Unfortunately, we did hit a roadblock this go round. I think the bill sponsor said it best as he was making his closing remarks. Is that it can't be that hard when it comes to reporting. It really isn't that difficult to identify whether or not at the time the property was seized, whether or not there was a criminal, not necessarily conviction, but a criminal charge during that particular action. That could be as simple as a checkbox on the documentation whenever they make that arrest or actually seize that property. One other thing that I think is interesting in that list of states, Grant, you notice that none of them are here in the Southeast.
Yeah. We'll get it figured out. You are right. None of them are in the Southeast. And I don't know.
I'm sure there's a reason for that.
Yeah, there is. But hey, it's one state at a time.
But we would be speculating, I'm sure.
Yeah, exactly, man. Hey, and by the way, if you want to make your voice heard on that issue in particular, and for us at Americans for Prosperity, it's all about being smart on crime, soft on taxpayers. It's all about protecting constitutional rights. It's all about making sure that those rights that are not given by government, that are given by, well, in the Judeo-Christian sense of the philosophy, the God himself, the words were uttered in the Declaration of Independence and the Constitution. Something higher than ourselves is giving those rights. That's what we're trying to protect here. If you want to take action, again, you're seeing the Facebook screen here. Click on the Evernote link as you're seeing right now. And scroll down here a little bit. You'll see House Bill 409 is the one that we just picked up there, just spoke about a second ago. Let's reform Tennessee's civil asset forfeiture laws. If you click and sign on this, you can read more a little bit right here. That's what it looks like on your screen. Sign the letter. There's some information. Fill that out. If you hit sign letter at the bottom, it will go directly to those committee members, which they will see it again before it hits subcommittee next week. And I'm sure they would appreciate to hear from you. We'd appreciate you all taking some action on that as well. James, let's move on here to just a quick run on a few other things that passed this week. House Bill 888. This is Chairman Curcio's bill that will just streamline the expunction process for legally innocent individuals, as well as expanding some of the eligibility of several nonviolent offenders. It did pass out of criminal justice subcommittee this week without much to do at all. I mean, there wasn't a single no vote, so that just
It's a good bill. It's something that they've been working on for a little bit. So this was also one of the bills that we had been working on last year before the closure of the legislature due to the pandemic. So I think a lot of the members were already familiar with this legislation, and we're eager to go ahead and move it along.
House Bill, you're going to see a lot of these bills coming up, by the way. House Bill 898, anything dealing, there were several bills out there on the Senate side and the House side that were dealing with bails, bonds, what was going to happen with that. A quick stat, by the way, what is it? 48% of people in jail in this state, James, have not been convicted of a crime, meaning they're just sitting there waiting for their trial.
Yeah, it's very, very close to 50% for sure.
Right. So something's going on that we got to figure out. It's a massive drain on taxpayers. But fortunately or unfortunately, I suppose, however you look at this, all of those bills have been wrapped up and kicked off to a summer study. Now, James, I'm fairly new to this whole world, and we only got about 10 minutes left in this program. So I want to get a couple other things in here. But real quick, typically, James, those summer studies are where bills goes to die. But after speaking with Senator Bell and a few others, Chairman Bell is the chair of the Senate Judiciary Committee. They are fairly intent on devoting substantial time to this issue over the summer to get all stakeholders involved and just get it right for next year. Is that same thing you're hearing?
Yeah, I think this is one of those instances where summer study will actually produce some good work, and I think there's enough folks who are interested in getting some type of bail bond reform passed in the near future. That they are willing to work on this, and I'm glad to hear that that seems to be the sense that we're getting from the bill sponsors, as well as some of the other folks that have been involved in this.
So all those bills, House side and Senate side, wrapped up into a summer study. We'll see what happens with that next year. Lastly, professional privilege tax. This is a $400 fine fee that certain professionals have to pay for the privilege of doing business here in Tennessee. It's like attorneys, lobbyists, doctors, stockbrokers, some of those folks, right?
It's very, very, very much cherry-picked professions.
Yeah, right. So in the House, this has already moved through all committee process. It's been placed behind the budget. We discussed what that means last week. They got to find funding for it somewhere, right? But on the Senate side, this was rolled 1 week, so you will see that next week. Speaking of bills, in the last 5-10 minutes here that you will see next week, quick rundown on some of the updates. House Bill 1315, 1315. This one, I'm telling y'all, this could be the biggest legislation to come out of this session, both years, or it could be one of the biggest pieces of legislation to come out of Tennessee in the last 5 to 10 years. That might be overstepping a little bit, James. Is it? I mean, it's a big bill, yeah?
I don't want to oversell it because right at the moment, the impact of this bill is relatively small in terms of which areas it might actually affect. But the idea, the concept is very huge. So, when we talk about truth in taxation and, making sure that we're holding our legislators accountable for their decision to raise property taxes, this is a big deal because too often those type of activities fly under the radar. Many property owners are not ever aware that they've been hit with a small property tax on a regular basis because it gets disguised in their mortgage payment. It's part of, gets escrowed. We discussed that a little bit last week. Most folks don't pay their property taxes directly. It's done through their mortgage, through a financial instrument called an escrow account. So for that reason, people don't become aware of small property taxes or regular increases in their property taxes until it's too late for them to do anything about it, often a year after the fact. So having this type of transparency where every single property owner that's impacted by a property tax increase would be notified in advance of the public, the vote by the local government, and have a public forum where they can voice their opinion on the particular issue. Some people may actually support a property tax increase. That does happen. There are occasions when it is necessary, and people want to support a property tax increase. They certainly should be made aware of when it's going to occur and have that opportunity.
Now, if you don't know, this is obviously modeled off of Utah's truth and taxation policy push from 1985. And here in Middle Tennessee, we are all absolutely aware of what a property tax increase can look like. We're just dealing with a 34% one. Some of y'all are dealing with a 37% one, depending on where you live, right? And James just said it a second ago. This bill intends to make it do the following. when a city or county has a reckless spending or debt problem, meaning that if they have a debt ratio that's above 10%, like Nashville, they, meaning the governing body, will be required to give detailed notice to citizens in advance of that tax increase, of that proposed tax increase. People will know exactly how much their individual taxes might go up, when that vote will be, and here's the important part, they will have the opportunity to be heard before officials can cast their vote. Officials obviously can then choose to listen to their constituents' concerns during the public hearings, or, listen to their constituents' concerns, because we live in a representative republic. Yeah. Right. There you go. Right. So, and I think, just
in most of the country.
Yeah, right. Yeah, exactly. Just to give a quick update out there too. For our Nashville folks, everybody remembers the Nashville Taxpayer Protection Act. James just spoke about a second ago. Attorney Jim Roberts, this has nothing to do with Americans for Prosperity, but just an update to let everyone know where it's coming from. I'm sure you're all aware he has been working on a separate, different referendum a second time around. He gave us word this morning that he has reached those number of signatures. He submitted those signatures for the second referendum coming through. More on that to come, so pay attention to Jim Roberts, see what's going on over there. There's big stuff happening. On the way out here, rapid fire stuff. House Bill 43, Senate Bill 456. This is basically the warrantless surveillance stuff. It says an officer, a law enforcement officer, cannot come on your private property that is not publicly open to the public. Your private property cannot come on your private property for the intention of engaging surveillance or setting up surveillance equipment without a warrant. That will come up in criminal justice full committee in the House on March 31st. It got out of subcommittee, but man, there were some sparks and fireworks. The DAs came in there. They had a lot of fun. They were going back and forth. It deals with something called the open fields doctrine. Some homework for everybody if you want to check that out. It's very interesting stuff. House Bill 870, another one to pay attention to this next week coming up. Senate Bill 893. It's moving in the House Criminal Justice Committee on March 31st. This is obviously ensuring that if criminal restitution is ordered, the victim is prioritized first. And I want to tell this quick story, James, of a story that we heard a district attorney tell in one of these meetings we were fortunate enough to sit in on, and why this bill is so important. He tells this story of a victim having $1,000 stole from I don't know if it was he or her or them or whoever it was. They had $1,000 stolen from them. And the defendant, a convicted individual, he's ordered to pay restitution back to this victim, obviously the $1,000 that was stolen. However, the defendant must pay court costs first, which typically deplete most or some of that $1,000 the defendant stole. The defendant must also pay litigation fees, which I just found out these litigation fees are what's being used to pay judges' pension funds. That's a totally different conversation, but follow along here. Now, lastly, the defendant pays the victim. Now, the victim of this entire thing is left holding the bag. So essentially what we have basically in that scenario, the defendant just used the victim's $1,000 to pay court costs, operating costs, and the judge's pension funds. The victim is left here with nothing at all except something on its conscience to say, did I really just have $1,000 stolen from me to pay how y'all are operating this? That's what the DAs, the district attorneys, were coming in and saying, this is why we are supportive of this bill, to make sure the victims are prioritized first, because they are the ones that are being doubly harmed here. Very interesting bill that's moving again, House Criminal Committee on March 31st, House Bill 870. On the way out, we already spoke about House Bill 2. That's the surprise medical billing. And if you look at the very bottom there, coming up in K-12 subcommittee, this is intra-district open enrollment. That comes up on March 31st, House Bill 1305. Very simple. Basically says, hey, if you have multiple high schools, multiple schools in the same district, and you can afford to get your child to that school, and that school has availability, meaning open seats, well, then you sort of have to put that information out there, and it just creates a uniform policy across the state. There's several districts that are already doing this intra-district open enrollment. That's, again, lightning round of what's coming up next week, stuff to pay attention to. On the way out, Mickey, David, James, anything else you want to bring up? Anything else you want to say? Anything else to pay attention to?
No, there's just a lot going on. I'm glad to have the privilege, along with Grant and Tori, to be up at the state capitol every day of session and work with wonderful legislators on wonderful legislation. Hopefully we can get a number of these things passed. This is an unusual session for us. There's not a whole lot that we're opposing. There's a lot of good stuff that we are in support of. And that's a huge departure from what has been our long-standing practice in the past, which was often trying to stop bad bills from seeing the light of day. But this has been a good session. Again, glad to be up there another week, and hopefully we'll see some of these things move along.
It's a great problem to have. And Mickey, I saw you turn the camera on there, man. Anything you want to say on the way out here?
I was just going to say, if you're infuriated, if you are passionate about lifting barriers out of people's lives, go on the Evernote link and click on some of this stuff, sign the petitions, and use this media toolkit. It's so powerful.
Yeah, it absolutely is. Media toolkit's a fantastic thing. Those messages are pre-written, by the way. Those media toolkits, you just have to click here. It immediately pastes into your own personal Twitter account. You hit send. And when we say petition, those letters go directly to legislators' emails inbox. I mean, it's not just gathering data and just sitting out there in the periphery somewhere. Anyways, my name is Grant Henry. For James Amundsen, Mickey Shelton, and David Thompson, we are signing off today. We love each and every one of y'all. We'll see y'all next week.